First, let's get to know what exactly a ureteral stent is.
Right, a ureteral stent is basically a tube. The tube we use is called a double J stent, which is curved at both ends. We insert it using a guide wire, placing it into the kidney, and once we remove the guide wire, it curls up. That's why we call it a double J stent, or double J. It has a double J shape at both ends. After removing the guide wire, one end coils in the kidney and the other coils in the bladder, so it stays fixed inside the body. So what is a double J? It's a tube.
All right, so what does the patient feel with it?
All right, so in most of the procedures we do with the endoscope, whether for bladder stones or kidney stones, we have to dilate the ureter. We dilate the ureter using serial dilators, sizes 6, 8, 10, and so on, until we reach a certain width that allows us to insert the endoscope. Then we break up the stone with a laser and remove it with a basket. After we finish, we need to place something in the ureter to support it so it doesn't close up again, so that no clots block the ureter, and so that no fragments from the stone we broke up fall and block the ureter. So we have to insert the stent. We place it after almost every or most endoscopic interventions in the ureter or kidney. We might also place it if there's something blocking the ureter, like an obstruction or external pressure on the ureter, which causes urine to back up into the kidney and prevents it from draining properly. In that case, we insert the guide wire into the ureter and place the stent over it to ensure urine can flow from the kidney and relieve the pressure.
So, as I recall, it's mainly to dilate the ureter so that nothing blocks it or narrows it.
We make sure urine flows from the kidney to the bladder.
Could you explain what exactly is the difference between these two things?
What's the difference between a stent and a catheter? The urinary system consists of 1 or 2 kidneys, and from each kidney comes a ureter, so 2 ureters, of course. Then they go down to the bladder, and from there urine exits through the urethra. The stent is placed inside the ureter between the kidney and the bladder, but the urinary catheter is a tube placed in the urethra. The urinary catheter drains urine from the bladder to the outside.
It just comes straight out.
Exactly, it comes straight out. But the stent stays inside the ureter, not in the urethra. They're 2 different things.
They're 2 different things?
Yes.
So what are the most common reasons that cause the ureter to get blocked or affected after surgery?
There are many significant blockages that can be caused by various types of injury, serious accidents, or after surgical procedures. It can also be due to the presence of tumors originating from outside the affected area. The ureter, a vital tube, can be compressed or completely closed off from the outside, perhaps by an external mass or pressure. There are also many blockages that happen quite unexpectedly or as an unintended consequence after certain surgical procedures, like following a hysterectomy or a C-section that unfortunately had some complications, such as the formation of adhesions. In such instances, the delicate ureter might inadvertently get tied off with a surgical stitch, or something else might constrict it, leading to a significant obstruction. Or, for example, uterine tumors. Anything that grows and presses against the wall of the ureter from the outside can cause narrowing. Bladder tumors can also narrow the ureter. Even the endoscope itself, if a stent isn't placed properly after the procedure, can lead to ureteral narrowing. That's why we always place a stent after using the endoscope to prevent any narrowing of the ureter following the intervention.
So, are these particular types of medical cases more commonly observed in women than in men, or is it essentially the same for both genders?
For whom exactly are you asking?
No, look, I'll tell you. No, look, I don't know why, but usually it tends to be more common in certain cases.
Yes, let me tell you. Kidney stones in general are actually more common in men. So, in general, stones are more frequent in men. And the placement of stents after endoscopy is also more common in men. But the other cases I mentioned, like ureteral obstruction, are more common in women. This usually happens after gynecological surgeries because the uterus is located right behind the bladder.
Exactly, that is absolutely correct.
Because the uterus sits on top of it and presses on it slowly. So whenever there's any issue with the uterus, whether it's tumors, pregnancy, or anything else, these things put pressure on the ureter. That's why we see these cases more in women than in men. But when it comes to kidney stones, they're definitely more common in men.
Kidney stones?
Yes, more common in men.
I'm saying, why are men more likely to get kidney stones? Yes, it's more common.
They're more likely because, look, first of all, it's genetic. Secondly, men tend to work more, so they sweat more, their physical exertion is higher, and they don't drink as much water. As a result, their urine becomes more concentrated, which increases the risk. That's why they tend to have recurrent urinary tract stones more often. Of course, we do see a lot of women with urinary tract stones, but it's much more common in men. There's a significant difference.